Okay, so in the last presentation, we discussed about nine common terms associated with the GMP. And in this presentation, we will talk about 8 additional important terms, common terms associated with the good manufacturing practices. The 10th common term is the consignment or the delivery. The quantity of a pharmaceutical or pharmaceuticals made by one manufacturer and supplied at one time in response to a particular request or the order. Suppose there is a company called as a Cipla, right? And Cipla manufactures the paracetamol, isn't it? So Dr. Reddy's and the lot of this paracetamol is, let us say, 100 kilogram. And DRL said that, oh, we need a 100 kg of the paracetamol. 100 kg of the paracetamol. Now, have Cipla given the entire 1000 kilogram of this lot? No. As Dr. Reddy's only need 100 kilogram, they have separated this 100 kilogram from this entire lot, and now this becomes the consignment. This is called as a consignment of a paracetamol, right? Consignment of a paracetamol supplied by the Cipla to a Dr. Reddy's, right? Delivered to the Dr. Reddy's. So this is the definition of the consignment. A consignment may comprise one or more packages or containers and may include material belonging to more than one batch. So sometimes 100 kilogram pack may not be possible. So Cipla has made a package of, let us say, 20 kilogram. So 20 kilogram into 5 packs will be available as a 100 kilogram batch. For example, if Cipla said that, oh, we don't have 100 kilogram available from this one lot, we have 60 kilogram available from this lot, and we have 40 kilogram available from another lot number ABC, and this is lot number XYZ. So here you said fine, you supply 60 kilogram from the lot number XYZ and another 40 kilogram from the lot number ABC. So it may be possible sometime that the consignment can have the different number of packs or even different number of batches too. Contamination. The undesired introduction of impurities of a chemical or microbiological nature or of a foreign matter into or onto a starting material or intermediate during production, sampling, packaging or repackaging, storage or the transport. So contamination can be the impurities of the chemicals. Means what? Suppose you are going to use starting material, and that starting material is for manufacturing the paracetamol API. So this has 1% impurity A. Now in case this impurity A still remains inside the manufacturing stage, and if the paracetamol finally manufactured has also found this 1% of impurity A, this is called as a contamination because of the starting material or because of the chemicals used. There could be microbiological contamination because of the water, or because if the hygienic condition is not maintained, non-hygienic condition, right? This microbiological contamination can, foreign matter, maybe because of your air is not purified, there are air particles, right? So these air particles can enter in the paracetamol. Because of that, you will have the foreign particle contamination. And then it can be a starting material or intermediate during the production. So if this is the starting material, and this can be an impurity of the paracetamol, impurity of an paracetamol. This starting material present at 0.1%, or there may be some intermediates intermediate products getting generated during the paracetamol batch, because it is not the one-step process. It has 1, 2, 3, maybe 4 and 5 stages, and there are going to be different intermediates. So your process should be effective in removing those intermediates, But will you be able to remove all those intermediates? Practically not possible, right? So there could be some traces of those intermediates, and they can be called as the contaminants. It could be happen during sampling, packaging, or storage or transfer also. Critical operation. An operation in the manufacturing process that may cause variation in the quality of the pharmaceutical product or cross contamination. So what is the example of critical operation? Let us say blending. Now blending is the operation which is going to define the homogeneity of the blend or homogeneity of the product. Homogeneity of the product. And this is a very crucial. Otherwise, your content uniformity in the batch manufactured or compressed may not be achieved. So this becomes the critical operation. And same is the operation which may have a risk of cross contamination. The 13th term is the finished product. A finished dosage form that has undergone all stages of manufacture, including packaging in its final container and labeling. So once you have the blister of the paracetamol tablet, right? The blister of the paracetamol tablet, having let us say 9 tablets per blister, and this blister is packaged in a carton. Okay, this is the carton, and this carton is finally loaded in the shipper. So the shipper may have maybe 100 or 200 such cartons. That is called as a finished product. In process control, checks performed during production in order to monitor and, if necessary, to adjust the process to ensure that the product conforms to its specification. Let us take example of again the paracetamol tablet, right? So what are the different stage of paracetamol tablet manufacturing? It could be granulation, followed by blending, followed by compression, and then goes the packaging. And these are there could be some in-process check at granulation stage or at the blending stage. So these are the checks for what purpose? To confirm that our final product, finished product, is going to meet the defined specification. What is the specification? Maybe the potency or assay, right? So if you don't confirm the assay at the granulation stage, if the assay is 90% only, right, your final product will also have the assay of 90% only, and you may fail in the meeting the specification. Or same cases for content uniformity, maybe in terms of impurities, etc. So it is very important for manufacturing to define such critical operations and have the appropriate control at those particular steps so that your final finished product is going to meet the defined specification. Finished product, a finished dosage form that has undergone all stages of manufacture, including packaging in its final container and the labeling. I think we talked about this point, okay, I'm so sorry. And we talked about the in-process control as well. Okay, so in-process control, we just taken an example of paracetamol, and we understand that the blending could be in process step or granulation could be in process step, and we have to define the specifications at those in process steps also. And mostly, sometimes the in process step specification can be little stringent. Now, why it is little stringent? Let us say your paracetamol assay limit is 90% to 110%. But you want to have the blend assay result between 95 to 105%. Why this stringent specification? Because you are not testing the entire blade manufacture, and there could be some analytical error associated. There could be some sampling error associated. So to just give the buffer space and to have this minimized risk, you don't want to go with the 90 to 110% spec for the blending, but you want to go with the 95 to 105 specification during the blending stage. So you are very much assured that the product is certainly going to have the assay surely between 90 to 110%. So this is the benefit of having the stringent specification, especially in case of the in-process control. What is the intermediate product? Partly processed product that must undergo further manufacturing steps before it becomes bulk product. I think we talked about the bulk product. Bulk product is what? One step away from packaging. One step away from the packaging. Like we talked about paracetamol core tablet, right? Paracetamol core tablet. They are not yet packaged, so they are called as the bulk product. What they are called? They are called as the bulk product. So what is the intermediate product now? The partly processed product that must undergo further manufacturing steps before it becomes a bulk product. So what is the previous step of the paracetamol core tablet? Maybe the blend, right? The blend ready for the compression. So this is called as the intermediate product. So blend becomes the intermediate products. Then this core tablets becomes the bulk product, and once the packaging gets over, then you get the finished product. Right? So intermediate product, bulk product, and the finished product. I think we talked about all these terms as of now, and especially this intermediate product or the bulk product can be the in-process steps. They are going to be in-process steps, right? And once you reach to the finished step, you are going to have the finished product in the hand, which is appropriately packaged by using the packaging materials. The 16th number term is the large volume parenterals. So sterile solutions intended for parenteral application with a volume of 100 ml or more in one container of the finished dosage form. That is called as the large volume parenterals, right? Especially the saline bottles, right? So if they are more than 100 ml capacity, they are called as the large volume parenterals. Manufacture. All operations of purchase of materials and products, production, quality control, release, storage, distribution of pharmaceutical product and related controls. They are called as a manufacturer, right? And what is the manufacturer? A company that carries out all the operations that we discuss now, that is called as the manufacturer. So Cipla is a manufacturer of of paracetamol API or paracetamol tablet. So how can Cipla become the manufacturer of the paracetamol tablet? By following all the steps required to manufacture of the paracetamol, and this may include procurement or purchase of the materials, production of the actual paracetamol tablet, testing the product under quality control, then releasing the product inside the market, then storing the product in the warehousing, conducting the distribution in the of the pharmaceutical product, and all related controls are going to be followed during the manufacturing of the paracetamol tablet. I hope you are clear with these two important terms, manufacture and manufacturer. Okay, so I think we talked about the 18 terms so far until this part number two. Let us meet in the next video where we'll talk about 9 to 10 additional terms related to the good manufacturing practices. Thank you so much.